We've heard of using Botox to smooth frown lines, but it can also be used to treat the symptoms of TMJ. So here with more on that is Dr. Stan Farrell from the Arizona Headache AZTMJ. AZ Headache, AZTMJ. There you go. It's got it covered.
We got it all. We got the headache and the TMJ.
This was interesting when I heard about this, that Botox can be used. First, let's talk about what TMJ is. Sure. What is it exactly?
Okay, so TMJ is really the name of the joint. It's temporomandibular joint.
Okay.
But people have, used it to describe either headaches or jaw pain or clicking or grinding or things like that. But really, it's just kind of it's been used, not correctly, but that's what it is. And some people are calling it TMD, which is temporomandibular disorder. To try to kind of as like a catch-all phrase for all these things. But really what it comes down to is people have either a nerve problem or a muscle problem or a joint problem, okay? Yes. And part of what we do is we analyze what is the problem, what's causing the problem. And often enough, it either gets in the way of people's ability to eat or socially because, they're popping and clicking and what's your problem,
Right.
And, or they have bad headaches. And this is very common as well.
All right, so now you're using Botox. How does it work?
Okay, so with a large number of our patients, we find that they have a lot of bad muscle spasms. And it's either because they're really heavy clenchers or they just have a lot of activity going on and it's really hard for them to control. So as we know, Botox for cosmetic reasons, it gets rid of the wrinkles because it makes it so that the muscles can't make the wrinkles or squeeze.
Sure.
Right? So it's really the same thing with these muscles that are causing pain. We're kind of deactivating the muscles so that they can't cause pain.
I got you. So you go ahead and there's a shot of it right there where you take that muscle into the jaw there so that it doesn't, whether it's clenching or spasming.
Yeah, and it's really just calming it down. And it calms it down for a good, 3 to 4 months.
I was saying, what do patients say about it?
Oh yeah, they say it's great. They feel good, and 4 months later they're like back and they're like rats. I was feeling so good. I felt like a new person for 3 to 4 months.
That's a pretty easy fix, though.
Oh, yeah.
I mean, no surgery. It's just a simple injection.
Yeah,
very nice. Very nice.
Yeah.
What other sort of things can you help folks with? Because I know you specialize in the TMJ.
Yeah, we do. I mean, that's the main part of our practice. But we also treat sleep apnea. So people that have the CPAP machine and they're not comfortable with that, we make an appliance they can wear in their mouth that brings the jaw forward, stretches the airway open. And usually they can get away from all that equipment that they have to wear on their head.
Now, for somebody who's watching and if they think, I think that's me, I've had this issue with my mouth, I always have headaches, this could very easily be a reason why you might be getting headaches that you couldn't figure out before. So
it's true. It's true. A lot of patients that come to us, basically they've seen multiple neurologists, all sorts of doctors, tried a bunch of different medications, and they still have really bad headaches and jaw pain. And then they go through life thinking, I got to put up with it. But the fact of the matter is they don't, because we're able now, through the training that we have, to zero in on the problem, get them feeling comfortable, and really get them, so that they can enjoy their family and their jobs and whatnot.
Very important. And we talked earlier when you mentioned TMJ or the or the treatments for it. It's not necessarily a dental. A lot of people think it's a dental insurance thing, but it's actually medical.
Well, yeah, I mean, from insurance, even from a treatment standpoint, it's for many years, the treatment of this has fallen on the laps of dentists, and what a dentist knows is teeth. So they've been trying to figure out ways to change the bite to get people better, and some have had some success, and some not. But we find now that it's mostly medical. So hence, that's why medical insurance is covering a lot of this. And so we don't even deal with dental insurance, we just deal with medical insurances.
Wow.
And we're able to get a lot of this treatment covered for patients, as well as Medicare.
That's great. So a lot of solutions. I was wondering too, if people who are suffering from this, if they even realize what they have until maybe somebody brings it to their attention. Have you ever had somebody where they don't even realize they have the clicking, or until somebody says, you notice you have this, or you're snoring and you don't even really know that you've got the issue, but you just wake up feeling
somebody
lousy.
will point it out to them.
Right.
Or they'll think it's normal. And that, to me, is the biggest crime, is where people go through life with the pain or the noise or the other problems, and they're like, well, that's normal. What are you going to do?
I got to live with it.
There's nothing you can do about it.
Yeah. Well, now there is. That's great.
Yeah,
that's great.
Absolutely.
Thank you. So good to see you again.
Thank you. Thank you.
Yeah, and if you think that's you out there who's thinking, I'm just living with this, there is an option for you. Very important. So if you want more information about treating TMJ, or if you want to contact Dr. Farrell, it's super easy. Just go to azheadache.com or aztmj.com, or there's the phone number on your screen. Lots of options for you. Thanks again.
Yeah, thank you.